Hi guys, how are you? Welcome to another episode of this channel. I hope you're having a great week. Today I am talking about patient advocates in the hospital setting, that is. And as people age, not necessarily age, anybody needs a patient advocate. If you're not familiar with medical terms and don't know what's going on, or your doctor is communicating with you but you don't know what's going on, it's good to have a medical patient advocate who can advocate for you. Doesn't need to be, they have medical advocates that you can get, but then if you have somebody in the healthcare field or a family member who can go with you to these appointments, understand what the doctor is asking you, ask questions for you on your behalf if you're not able to ask on your own, clarify things for you that you're not able to. Most people are not well versed with medical knowledge, and it can be a little complex for you. So if you have somebody that can side with you, ask the questions, clarify the questions or medications. If it is a new diagnosis, repeat and understand exactly what the diagnosis is, explain it to you in better terms than you would understand. It would be nice for each one of us to have a patient advocate. They do have medical patient advocates, and those are official. This ones navigate the healthcare system, not so much your health. They do the health, they do insurance, they find you legal help, they work with social workers, hospital doctors, and everybody involved in your healthcare plan. So they have the official ones, but you as a person can get, a friend who understands the healthcare field, a friend who's a nurse, a friend who's in the medical field, whatever it is, but understands it better than you do. You can get that so that they can navigate the system for you. It can be a little complex, especially if you're not familiar, you're sick, you're thinking of asking questions. When the doctor arrives, you forget the questions you were asking. If you do have a patient advocate with you, what they can do is they can ask these questions for you. They'll ask the questions for you, and then it can be explained to them, and they can in turn explain it to you better so that you're able to understand and it's not so overwhelming for you. Who can these people be? As I said, it can be a spouse, it can be a relative, it can be a friend who's in the healthcare field, or it can be a caregiver that you trust with your health. So any of those can stand in as your patient advocate. You do have designated advocates if you request them, but family member or somebody who knows you better is also able to do it for you. But if you want an official one, they do have official ones. Healthcare one, if you're an older adult, you'd benefit from this. If you don't have any of the mentioned people, a family member, a friend, or a caregiver that you trust, or a friend who's in the healthcare field, then it would be beneficial to get one of these people to come with you to this appointment. So if you're hospitalized, be there with you in the hospital, ask the questions. You probably have written them down so that when the doctor comes, this patient advocate can do it for you. I have seen when patients are pretty sick and there's nobody to advocate for them, the only person you have is your nurse. And if you do have a good nurse, it's a good thing, then they can do that for you. But if you don't have a good nurse, then it's hard, or if they're busy, because most of them are overwhelmed, they have other patients to take care of. If you do have a good nurse, there are good nurses that will advocate for you just as taking care of you, be it a day or so. She notices that you have concerns and can take it upon herself. But their time is limited and they have other patients that they have. So I would advocate just for you to get your own, whoever it is, family member, spouse, caregiver who you trust, or the official patient advocate to advocate for you while you are hospitalized, not necessarily hospitalized. When you go to doctor's appointments, they can ask questions for you that you're not able to. A good health advocate is organized, calm, writes down the questions, comfortable asking questions, and is not intimidated by, the white coats or any doctor that is in healthcare or whoever it is that is explaining to them. So the most important thing when you're choosing one, look for somebody you respect and trust so that when the time comes, they can do it for you, and more especially if they're caring for you. I didn't think much about it when I was in the hospital, but you see some patients who don't have anybody with them, and as a nurse, it cuts you to the core and it's your responsibility. You find yourself, advocating for them and stuff. But that was pre-COVID, when I was in the hospital. I haven't worked the hospital in years. But if you do have, right now the shortage is so much, I'd rather you just have your own person, and these people can advocate for you while you're in the hospital, while you're sick, while you're navigating doctor's appointments, not necessarily the hospital. You can work with a healthcare advocate. They do have them. They'll explain things for you more clearly. They'll provide details of your medical history for you. They will take notes as the doctor talks to you. They do take notes on your behalf, so that if you do want a clarification, they can go over them for you. Some of them will record the conversations with a healthcare professional, so that they can ask them or repeat the questions to them to clarify what it is they were saying. You can give your advocate contact information to your healthcare team, and they can call them if they missed them coming to you or at your appointment. Then they can call them and clarify for you and say, did you mean to say this is what is going on with the patient? It is your right as a patient to know. So it is good to have these people that advocate for you and be there for you generally, trusted members that are there for you, that have your interests at heart. Because no healthcare provider will you call and they won't explain to you. They're usually really able to explain to you. And anytime in life, one of us will get sick, no matter who you are. Anytime you will get sick, you'll have to see a doctor. Even if you're not hospitalized, you do see your primary care doctor. Go with a patient advocate. If you're not understanding, do not be scared to ask. Go with somebody who's comfortable asking the questions for you, so that they can ask the questions for you and explain them to you. That way, you are well versed with your health and what is going on with you. And if you have questions, they've clarified them for you, and they can ask you or the doctor, and you guys are a trio that works well together for your overall health. An advocate is not just for doctor's visits or hospital stays. You can discuss any health issues with them if you're comfortable with them. If you're not comfortable, you need to get one that you're comfortable with. They can offer a perspective that you don't see. They can ask questions that you were not thinking of. They can help you make some decisions. Sometimes you need to make a decision, and these people can help you make a decision. Particularly important for older people. But as I said, one time in your life, me or you are usually hospitalized at least once in our lives. So you just need them generally. Older people do need them mainly just because they have a lot going on, and sometimes they'll forget, or they won't clarify, or they may not understand what is going on. So it is good to have a healthcare advocate. And we always tell you people these things we see in real life. You see somebody been hospitalized for a long time and they don't have any body clothes, or family members are out of state. A person like that would benefit from a patient advocate who's within state, or a close friend or a caregiver that takes care of them as their family is out of state, so that they're not worried about what they're going through and what the doctor is saying. So all of you, it would be nice if you can organize a patient advocate at any one time in life. All of us will get sick, we'll go see a doctor. If you don't get sick, you have your doctor's appointments. If you're comfortable with that and you can ask questions, you don't need one. But the more complex ones, you actually do need one. So this is just my tidbit for you guys. I do give you advice. I am not your nurse practitioner. I give you advice on general topics. But if you do have primary care or an advocate of your own, then you can use. Mine is general advice. You are my audience, but you're not my patients. So my advice to you guys is usually general advice. If you want specific advice, then you go to your primary care provider, whoever your nurse practitioner is, your physician assistant, or whoever you see on a regular basis. You guys have a great week, and I wish you all the best, and we'll see you next week. Take care. Bye-bye.